Good afternoon, everyone. My name is Christina McGuire. I am the internship coordinator with the Career Center, and I'm joined today with Sansum Clinic, and we have Shawneen Flanders-Clark, talent acquisitions, and Michael Thoman, who will also be presenting about the opportunities to work at Sansum Clinic. So I hope you enjoy, and I'll have them take it away.
Awesome. So as Christine mentioned, we are Sansum Clinic. We've kind of been in the community for a little while. I'm sure most of you have heard of us. So Michael, I'm going to let you take it from here on this one.
Okay. Hi, everybody. My name is Michael Thoman. I am a recruiter at Sansum Clinic. Just some quick facts about us, some things that make us unique. We're 102 years old, founded in 1921. I mean, you can see everything that's written here. 200 plus physicians, over 1,500 employees, 700,000 visits a year with more than 120,000 patients, all specialties except neurosurgery and pediatric subspecialties. We use Epic for our electronic medical records, and we are a nonprofit organization, which makes us pretty unique for a healthcare provider of our size. So some of the reasons to work in healthcare, some of the things to look forward to. I had never worked in healthcare up until about 2 years ago. I had recruited before, but mostly for hospitality. One thing that I've noticed is that hiring nurses, which is mainly what I do all day, every day, it makes a difference in my life because I feel like I'm helping the community. So for you as nurses or any other medical professional, you will find fulfillment in making a difference in people's lives daily, small things, large things, but it's a wonderful feeling to get that fulfillment for benefiting people and helping their lives go in a positive way. Many different job opportunities for various education levels. At Sansum, and as with most other medical healthcare providers, there's entry-level positions that require a high school diploma. There's, registered nurse and LVN positions that require diplomas or certificates or even degrees. And then, of course, there's physicians, which definitely require degrees, but there's opportunities across the entire spectrum. Also, there's many different jobs for every different personality type, even just for nurses, to use RNs as an example. If you like the fast-paced kind of, you never know what you're going to get, and you like to be interacting with people all day, you could maybe gravitate towards urgent care or the emergency room. If you're looking for something a bit more low impact and don't necessarily like the craziness, maybe go towards something like podiatry or allergies, something that's not going to be go 24/7 while you work there. It's also a very stimulating work environment, interacting with people all day, every day. Generally, when people come into the clinic, they're not having the best day. So that's another kind of opportunity to kind of, use your skill set to interact with them, find out what's wrong, and then to help them, throughout the day. Many of our positions, I take that back. At Sansum, we have clinic hours. So it's Monday through Friday, 8 to 5 for the vast majority of our nursing positions anyway. At hospitals, obviously, there's different work schedules that can be very flexible to work around whatever you're looking for. Some people like the midnight or the graveyard shift. Some nurses like to work 3 12-hour shifts. Many nurses like to work the 5 8-hour shifts, which Sansum does offer. And of course, there's many different specialties to work in. I mentioned a couple of them earlier. Anything from allergy, podiatry, to family medicine, to pediatrics, emergency room, urgent care, whatever kind of work you're looking for, whatever kind of environment that you thrive in or you want to be in, you can find something pretty close. It's also a very respectable line of work. As I mentioned previously, when I was working in hospitality, it was different. I wasn't really helping people. You can help people to have like a good night or a good vacation or a good stay, but to be able to truly impact someone's life and to improve their health and thus their quality of life is, in my opinion, extremely respectable. And you do feel that day in and day out. There's also a variety of different career paths. Again, I'll use registered nurses for an example. You could be happy being a registered nurse and doing that basically, your entire career. You could maybe want to shoot a little bit higher. Maybe you want to be a supervisor. You could be a charge nurse. You can keep continuing your education too, to not only move up in your chosen profession, maybe even switch. Also, healthcare jobs are always and always will be in demand, as I'm sure many of you know. There will never not be a need for medical professionals. And again, touching on job satisfaction, it's where the fulfillment comes in. Doing something to help the community that you live in, doing something to help people that are needing help is an extremely satisfactory feeling. And then also earning potential. You can make some very, very good money working in the medical field, especially for just an example off the top of my head, traveling nurses. They can make a ridiculous amount of money going and working contracts all throughout the country. You can also make great money just staying in your hometown, like working at Sansum. So at Sansum, currently we have 4 recruiters. We kind of divide the jobs up. Like I have almost all of the nurses, but I also have a couple of non-clinical roles. One of them is the buyer, which is pretty self-explanatory. The buyer handles inventory, negotiates prices and purchases for all of the clinics and all of the corporate offices. A pharmacy technician, I'm actually looking for one right now. It's quite a difficult position to fill. But the pharmacy tech or farm tech is the one who works at the pharmacy that is not the pharmacist. They help. They help do inventory control. They help fill prescriptions sometimes. Generally, it's kind of a stepping stone towards becoming a pharmacist, but not always. A lot of farm techs are happy just being farm techs and just helping out. I also have the HR coordinator position, which is kind of the end-all be-all person that organizes and oversees our HR corporate office. They sit at the front desk, they take telephone calls, they give people directions, they help people find where they're going, and they generally run all of the administrative tasks for the human resources office. And I think I'll let Shawnee take it from here.
No, they love hearing you talk, Michael.
Yeah.
Some of the other non-clinical positions that we have at Sansum Clinic are our patient service representative. You've all been to the doctor, I'm sure, at some point in your life, and the first person you meet when you walk in, you let them know you're here to see whomever. That is our patient service representative. They will check you in, they will get your insurance information, they will make sure they've got the right contact information for you. They'll let the physician know that you're there to see them, or the nurse practitioner or the PA. But they are basically the first point of contact for any patient that comes to the door. With that, though, also comes, somebody who would need to have good customer service experience and someone who has compassion, because as Michael had mentioned, these people, let's be honest, nobody goes to the doctor because they want to. They usually go because they have to. And so it's, it can be a very humbling experience, and, people feel very vulnerable. So this person, has the responsibility of being, as that first point of contact, they have the responsibility of providing a sense of calmness and empathy for these people so that they will be put at ease to, start their appointment with their provider. Next would be our customer service rep. And these are usually the people who, if you call our clinic, these are usually the people you'll be talking to. So if you have any questions about your bill, or you've got a follow-up question for a provider, or you need to get a refill, all these things will go through our customer service reps. So again, these are people who have great customer service. They're usually not in front of people. They're usually just kind of answering phone calls. Some of our customer service reps are able to work remotely. Some of them have to work in the office. It really just depends on your skill level and the ability that you display to your hiring manager to show that you're competent in the position. The credentialing specialist, this is a position that works with our physicians and with our what we call the Inc. side, our incorporated side. These people are the ones who get the physicians privileged for the hospital. We make sure they get their malpractice insurance. They collect all the documentation for education, licensures, certifications, all of those things. That's kind of, they're basically the right hand of the providers. They're the ones that make sure that every year they get their privileges renewed at the hospital and remind them when they need to get their licenses renewed. So they do get to work hand in hand with the providers, and it's honestly probably one of the best positions we have. And I say that because I've been recruiting physicians forever. So It's a good position. Then we have our surgery schedulers, and it's not just for like our outpatient surgery center, because we do have 3 different kind of surgery facilities. So one is our Pueblo clinic, one is our Foothill clinic, and then the other is our ophthalmology clinic for minor eye procedures that they do on patients. For the life of me, nothing comes to mind. Glaucoma. So basically, these people will talk to candidates and providers and find out at times that work with them. They'll get them scheduled. They'll get all of their history, their insurance information, so that everything's set for when they come to their appointment for their procedure. And then lastly, it's our unit coordinator. And basically, we only have unit coordinators in one clinic. That's our urgent care clinic. It's the only clinic that we have open on the weekends. They do have a shift differential with that one. Well, it's not a differential. They have different shifts. Sorry. So a unit coordinator gets to work 4 10-hour shifts a week. The RNs in that department, they get to work 3 12s for that clinic. And I think the MAs work 3 12s as well. So if you're looking for something that might have some weekend work, that might be a good opportunity. You know, if you've got a second job or something you need to kind of coordinate, that would be a good opportunity for that. Then we've got our clinical positions, and our dermatology tech. This is a person who is an MA and a scribe at the same time. So our derm techs are, well, our dermatologists, they usually are seeing 40 plus patients per day. So they're pretty busy. And so in order to maintain that level of patients, obviously, I mean, you could do the math, they're probably seeing 1 every 10 minutes. And in order to do that, do minor procedures in that time frame, they have to have a scribe who takes notes, puts in all the documentation that the provider would normally do. And at the end of the day, the provider will review them all. Most of our dermatologists have probably 3 to 4 derm techs that they work with. So if you've got really good typing skills and you've got your MA, ENT, or CNA certification, that would be a great opportunity. Our echo tech is a sonographer for the heart. This one requires obviously a certification and training for the program, but they do work directly with our cardiologist. Our endoscopy techs are basically MAs, so MA, ENT, or EMT, sorry, and our CNA that do help with the gastroenterologist doing their procedures, you know, with sigmoidoscopies and things like that. And then I'll let Michael finish the rest of these.
The pharmacist, pretty straightforward, fills the prescriptions. Licensed vocational nurse is basically responsible for basic patient care. Whereas registered nurses, they assess patient conditions, they record medical symptoms and histories, they administer meds, and they can also supervise LVNs. And actually, Shawneen, if you could cover the rad tech.
Okay, so our radiology department has a variety of different specialties for that they cover. So some of our rad techs do just CTs, some do MRIs, some do mammos, some do bone density. Anybody that has their radiology certification will be able to get their experience in these areas, so that in usually about 6 months of experience, you'll be able to test, get that certification, and add that to your tool belt as well. This rest of the section is kind of stuff that we thought we would share with you as far as looking for a job and things to think about.
So it's very important that you know your skill set. You know, people sometimes will pad their resumes a little bit, try to make themselves look as good as humanly possible, but it's very important if you want to end up in a position where you are happy at your job, that you know what you are capable of, know what you excel at, know what your weaknesses are, and just don't fool yourself when it comes to this. I've taken jobs in the past where I thought I would excel, and I thought I would you know, be happy. Turns out I wasn't, and because I didn't take an honest look at what was expected of me, you know, how I operate just on a day-to-day basis. You want to make sure you're compatible with the company, the clinic, wherever you end up, with the team as well. It makes a massive difference to be in a positive work environment with people that you get along with. And kind of in addition to all that, and kind of just to continue on. Be prepared with your pain points. Know what you do not want to do. Know what situations you do not flourish in. Just know what affects you negatively, and obviously just try to stay away from that. But you won't know unless you ask these questions and are aware of what you do not want, just as much as what you do want when you're in an interview. Don't be afraid to ask questions to the recruiters or to the hiring manager, whoever you're talking to. And again, it kind of leads into don't be afraid to ask if you don't know. If you don't ask, you're probably not going to get the answer, or at least the information that you truly need. It's not a sign of weakness to ask that you don't know. In fact, it's a bonus. It makes, in my opinion, as a recruiter, doing 4 to 7 interviews a day, the people that are engaged, the people that are curious, and the people that ask questions are the ones that I kind of lean towards when it comes to time to make a decision. Also, find out about the organization, real basic stuff. Just Google them. You can find out what they've done lately, if they've been in the news, if they are part of the community, if they are contributing to the community. And you'll kind of get a kind of a grasp on their overall reputation by just literally Googling them and seeing what comes up. You can check certain sites like Glassdoor, but always take that with a grain of salt. Former employees can sometimes leave reviews, or angry customers, but you'll get a general picture of it if you just take in, maybe the first couple pages of Google and see what the community is saying about the company. This is very important for us in Santa Barbara. Location and cost of living. I mean, obviously, if you're going to be relocating somewhere, you need to make sure that you can survive there. You need to make sure that, well, our environment is a difficult one to survive in. The cost of living in Santa Barbara is very high. The pay scales are also quite high too, but compared to the rest of the country, the West Coast, and in particular the Central Coast, is very, very expensive. So you need to just kind of look at that. If you are thinking about relocating, look at what the average rents are. Look at even if there's housing available. As we all know, housing in Santa Barbara is a very short supply. So it's very difficult for us to bring in people from outside, even if they're qualified, even if they love, the pay. Sometimes it's just difficult to find them a place to live. Talked a little bit about this before. What kind of schedule do you want? Do you want the clinical hours, Monday through Friday, 8 to 5? Do you want the 312s? Do you want the graveyard shift? These are all very important things to consider and to ask about when you're interviewing. And for registered nurses, do you want to be on call or not? And these will all affect your life, moving forward in the future drastically. So again, know what you want, know what you don't want, know what's going to make you happy, know what you can deal with, and just be honest with yourself. And lastly, is there growth potential? Are there ways for me to move up? Are there avenues where I can, continue my education and potentially get another cert or another degree and, maybe make some more money?
Michael kind of touched on a little bit what to look for in an organization when you research an organization. I know when I conduct interviews and people have done their research on our organization and they'll ask questions. Oh, I saw on your website, you guys are doing this. Can you tell me a little bit more about it? Things like that. It really does. I really feel like the candidate has done their homework. They really are interested in our organization. I feel like there's so much, even just looking at social media, you can learn about an organization. Are the employees happy? Do they look happy? I mean, obviously people can stage those pictures, but most situations, if it's random pictures of people at, say, food courts or the farmers market, sharing with them, or the kids at Camp Wees. We do have Camp Wees in the summer, helping kids with asthma. So pictures like that, you'll be able to see, do those people look happy doing what they're doing? Other things to look at, why are people leaving the organization? Michael said the cost of living in Santa Barbara is really high. Will you make enough in your position to maintain the lifestyle that you want living in Santa Barbara? And will that position or the growth potential in that position allow you to maintain that as well? The infrastructure of the system or of the organization. As Michael mentioned earlier, we use Epic for our electronic medical records. It's one of the best systems that are out there. I think there's maybe one other that's close as far as quality, but Epic is one of the best ones out there. But other organizations, what are they using? I mean, are they using something that's antiquated? VA hospitals, their EMR programs are the same ones they've had for 30 years. So you want to make sure that people are investing money into making your job easier, because if you're having to do paper charts, that's a whole different world. You're going to spend a lot of time doing manual writing, and the providers will, and there's a lot of extra work that goes into it. Compensation, for-profit versus nonprofit. This is something that Michael will touch on a little bit later, but as far as compensation goes, I mean, as a nonprofit, we're not, at the end of the year, our budget is break even kind of thing. So we'll never be our highest paying organization in the community, but we're about the 50 percentile. So we're not the lowest, we're in the middle, which is nice, because, you being a nonprofit organization, you do feel good about yourself. It does bring a little extra something to the table when you're telling people, oh, I work for a nonprofit. They feel like, you're giving back to your community. And what's reputation? Michael kind of touched on that a little bit earlier. And visit the facility to see if the people are happy and miserable. We're going to touch on this a little bit more later too. It's called our site visits, which I highly recommend if you're ever going to do an interview with an organization. Request a site visits, and I'll kind of go into that a little bit later on why.
So benefits to consider when you do sign an offer letter and you do join a company. Even before that, during the interview process, I have candidates ask me all the time, what benefits do you offer? Every company I can think of has a benefits package. They usually have a benefits pamphlet. And it's very important that you look into what you're kind of signing up for. One of the biggest selling points that I have as a recruiter at Sansum, again, we're a nonprofit, like Shawneen mentioned. We don't have the most money. It's tough to compete with our main competitors. But one thing that we do have, we have an extremely comprehensive and an extremely affordable medical benefits package. So medical, dental, and vision. For full coverage, I have medical and dental, and I don't pay very much. I pay, I think, $52 a month, which is pretty low, and it's complete full coverage. You also want to look into what the company offers as far as disability insurance, long-term disability insurance, life insurance, excuse me, and then what kind of retirement funding. We at Sansum are a nonprofit, so we have a 403B, which is similar to 401k, but it's just a little bit different because it is, from a nonprofit. Another very important one is paid time off. How much you get, how you accrue it. There's kind of a new trend where some companies are doing unlimited PTO. Make sure you know what you're walking into and what you're signing up for. Excuse me. As far as kind of moving beyond PTO, paid holidays. Do you get all government holidays off? Did you have to work, for President's Day, or did you get it off? We worked on President's Day.
We did.
Either way, just make sure you ask so you know what to expect moving forward. Also, for your healthcare, your FSA, your flexible spending account, or kind of the similar thing, healthcare spending account, money that you save that is not taxed, that you can use for healthcare purposes, whether it's getting a root canal or buying crutches for yourself. Make sure you look into that as well. And then for positions that require licenses, continuing medical education, board exam fees, or new or additional certifications, ask if the company covers the costs of any of these. A lot of companies will cover some of them. Some cover all, but very, very often they will cover at least some portion of the cost for each one of these.
And also for people who have kids, dependent spending account. It's very similar to the flexible spending account, but you can use it to pay for any daycare that you have to pay for your children while you go to work. We offer that one as well. Site visits. I touched on this a little bit earlier. I tell everybody that I interview to try to do a site visit. I feel like there's so much that you can learn about going to the facility where you're going to be working. When you walk in the door, are people in the lobby sitting there waiting to be helped? Are there long lines of people waiting in line to get to the patient service rep, or, depending where you are, to speak with the front office clerk or whatever? Are people in the lobby upset? Are they happy? Do they feel like they're getting the care that they need or the attention that they need? Are the phones ringing off the hook and nobody's answering them? Is there one person covering the whole front desk and there's 20, 30 people in line? Or is the lobby fairly empty and the people at the front desk are either answering phones or helping people and everybody's smiling and happy? I feel like that first impression when you walk in is really going to be, a sign of what it's going to look like when you go into the next room. So like with us being a healthcare clinic, that we call that the back office, and that'll be where you do your, you go get your vitals, your history's done. They'll put you in a room. You'll wait for the physician. You'll meet with your MA. They'll kind of go over what to expect. They'll do your blood pressure, ask you a little more questions about your health, the reason you're there. In that whole process, when you walk to the scale or whatever, when look around, are people being just put into rooms and ignored? Are there people visiting with the patients? Are the patients being forgot about or well attended to? Are people just sitting around, gathering around the water cooler, visiting and socializing? Or is the number one priority the patient and making sure that their needs are met? Which, for us, I hope and pray, I really encourage all of our people that we work with to make sure that they know that that is the priority. And another thing, when you're working in a place, if people are sitting around socializing and nobody's taking care of the patients, who's picking up their work? You want to make sure that, it's an environment where it's very team oriented and that everybody's helping each other and that the care of the patient is the highest priority and everybody's doing what they can to make sure that that's what is being taken care of. Other questions to ask, obviously some of these questions can be asked before you do the site visit, but how many physicians are going to be in each clinic? Some of our clinics are small. They'll have maybe 1 or 2 physicians in them. Some of them are going to be bigger, like our primary care specialties. They'll have probably 6 to 8 providers in each clinic. So find out the number of providers in the clinic, what their support staff is looking like. What's the salary range for the position? Michael will kind of go into that a little bit as well. And 3 years down the road, what's your earning potential? Is there growth potential in that position? A lot of people will think, if I start off as a patient service rep, what's my growth opportunity? Well, we've got coordinators for patient service reps. We offer supervisors, managers for service reps. We offer opportunities to, continue your education to, maybe become an MA, or a lot of people who start as an MA, they'll do it after they've got their bachelor's degree. They'll take a year off because they want to do or get their experience in healthcare before they apply to med school, which is great because a lot of our physicians are more than happy to do some mock trials with you or some mock interviews with you, ask you some of the questions to expect. It really is a good opportunity to use those providers to learn as much as you can, especially if you're going to go on and get your RN, learn what you can about that specialty or other specialties. I tell people all the time, if you're an MA and you're going to go to RN school, there are some specialties that'll be better for you than others, like internal medicine. It deals with every system in the body, whereas podiatry is pretty much knee down. Neurology, it's just one system. But there are some specialties where you do get to work in multiple systems in the body, so you will learn a lot of different things.
So when it comes to compensation, many candidates that I interact with, interview, and eventually negotiate with, they seem to be a bit nervous about this, and it's totally understandable. Before I was a recruiter, I was always very nervous when this conversation came up. I didn't know how much I could push back. I didn't know the kind of unwritten rules, but it's just, you learn from experience. So these are some things to think about. When you do apply to a company and you're interviewing, maybe ask them how they calculate their pay scale. Shawneen kind of touched on how we do ours. We kind of just are right in the middle. Not the highest, not the lowest, kind of like the happy medium. Ask how your experience might affect your pay. Just as an example, at Sansum, for, again, registered nurses, experience hugely affects your pay. your years of experience and your years of experience in whatever field you may be applying for. Say you've been an urgent care nurse for 15 years. You're going to get a better offer than someone who's been maybe a family medicine nurse for 2 years and urgent care nurse for 2 years. That experience usually plays a large role in the pay scale, or the pay offered rather. Excuse me, I touched on this a little bit before, but are there reviews? Are there yearly reviews, quarterly reviews? Do you get a merit increase if your yearly review is good? Do you get cost of living increases? All these things aren't universal, and you need to ask about them again, just so you know what you are, signing up for, what to look forwards to in the future, or what to expect that's going to be coming down the road. I know personally for me, up until pretty recently, I'm 42, but up until I was probably about 35, I never considered these things. They just kind of came with the territory. I was mostly concerned about, hey, I got a good job, the pay's pretty good, there's decent benefits, I'm happy. But if you dig into it, there's a lot of other things that you need to watch out for, a lot of other things that can affect you down the line that maybe you don't think about initially. So these are just some of them. Shawneen also touched on opportunities to make more money down the line. In the medical field, generally you make more money the more experience you have, which degrees you've accrued, which certificates you've accrued. Things like that will generally guarantee you a little pay bump, but also opportunities for advancement. Say you move from just a regular RN to, a charge nurse or a supervisory role. There generally are ways to make more money, kind of doing the same thing, but just with a little bit of extra responsibility, but you won't know unless you ask about it. So keep that in the forefront.
This is the hard one. I always tell everybody, all right, it's my hardest question I have to ask you.
It's true though. Is this me or you?
Yep.
Okay. So this will come up in every, interview process. If and when it comes time to make an offer, the recruiter should bring it up. They cannot really ask you what you're making now, but they can ask you things like, so what would a number be that you're comfortable with? Or do you have a number in mind as far as compensation that you're looking to make? Some candidates are kind of cagey and they won't really say, so they'll ask, hey, can you tell me your pay range? And I say, oh yeah, of course I can do that. So it's just kind of a little bit of a give and take between the recruiter and the candidate. But the only way that you are going to be offered more money than they initially offered you is if you do push back. And as a recruiter, maybe I shouldn't be spilling all these secrets, but that's definitely how it's going to be for you to get your best deal possible. There will be an initial offer. If it's not what you're looking for, you can push back and, maybe counter offer with, $3 or $4 or $5 above that and see what happens. It's kind of like a little game. There's definitely a skill set to it, but don't be hesitant. Do not hesitate to look after your own best interests. The only way you're going to get, a better offer than initially offered is to negotiate. And then when it comes time to negotiate, maybe do a little bit better than I need more money. It's good to say, hey, I've got all these student loans. I just moved to Santa Barbara, rent's ridiculous. Any little bit will help. Just kind of explain it rather than just, saying I need more money. You can't just leave it at that. It's to your benefit to kind of extrapolate and talk about, why you need this money. Also, it's a fine line. For me as a recruiter, one of the kind of biggest red flags is when I ask someone what they're looking for in a job and they say money. They say, I want to make money. And that's all they seem to care about. It leaves a sour taste in my mouth as a recruiter. So just make sure that, yeah, you're kind of upfront about what you're looking for, and you can be stern about, your limits about what you're willing to work for, but try not to make it the only lasting memory that the recruiter has of you, is that all you cared about was money. It's not the best look. And then also, and this kind of comes down to it, kind of have a number that you're not willing to work any lower for. Let's say you're looking for whatever, $38 an hour. And so the recruiter keeps pushing you for 36, 36.50, 36.75, but you don't feel comfortable. It doesn't match your budget. Don't be afraid to walk away. I mean, you need to make a certain amount of money to live. Be aware of what that number is, so you don't kind of get yourself into a bind, moving forward.
Especially with the cost of eggs going up.
Yeah. And everything else.
And this one, Michael and I were back and forth on what to title this one, but Obvious Things was one of those things we just ended up with. So you can put it on me if you don't like the name of the sheet. I'm sorry. But things to consider when you go in for an interview. Obviously, you want to present yourself well. You want to put your best foot forward, be mindful, are you sitting there shaking? Is your foot, trembling or shaking and you're just bouncing up and down? Don't be nervous. Just remember the person interviewing you is probably a little bit nervous as well. They've never met you before. They don't know what to expect. Just imagine that you're both on the equal kind of playing field. They just want to learn about you, which nobody knows better than you. So just try to be as comfortable as you can, even though it is not a comfortable situation, because interviews are never comfortable. And Michael and I can attest to this. I try to make more of a conversation than I do. And I'm the worst because I don't like asking situational conversation or questions. I hate those. I think they're the most uncomfortable ones. So tell me about a time when you're thrown into the spotlight and you're like, okay, deer in a headlight, trying to remember the last time you were in a stressful situation and what you did and what was the outcome and what did you do. I prefer have a good conversation. You can learn a lot about a person just from talking to them. Other things, Michael mentioned some questions that you might have beforehand. An interviewer should answer most of the questions you would have before you get to the Q&A part of the interview. If they don't, have a few extra questions for them. Like for us, I get a lot of questions about scrubs. Do you provide scrubs? What color scrubs am I supposed to have? Does it matter? Who would know this information? Things like that. Be prepared with them. Couple extra questions, not a big deal. We're here to answer as many questions as we give. So don't worry about that. Thank you notes are always nice. In today's world, a thank you email goes a long way. I know for me, if you interview with me and then you interview with one of my hiring managers, I'll share that email with them as well. Let them know, hey, this person really is interested in this job. They really appreciated our time. They put forth that extra effort to just tell us, this is what I liked about it. Thank you. All that. I think those are wonderful things. Being mindful of the needs. How urgent is the employer's needs? A lot of that is also going to be dependent upon when they have new employee orientations. For us, thank heavens, we are back to live new employee orientations again. Finally, after almost 3 years, it feels like it's been a long time. But the number of people that they can put in is also going to be a dependent factor. But for the most part, I think most positions, it's for us anyways, it's very rare that we get a position with a month's notice before the person is leaving the position. A lot of times they'll give notice, give you 2 weeks, and then we've got 2 weeks to fill it. And the odds of us finding somebody within that 2 weeks with interviews and site visits and everything else is going to be very hard. So it's always good to ask, what is your time frame? Because you want to make sure that it matches with yours. And I do know that there are some organizations that they have a long time frame, and you may not hear from them for a couple months just because they're collecting candidates and they're going to review all the candidates at one time and move them forward in groups of candidates, highest to lowest kind of thing. I know for us, one of our biggest things that I've been pushing for since I started was providing a good experience for candidates. One of the biggest things that I push for is that we contact our candidates within 24 hours of application. Now, the weekends are a little different because we don't work on the weekends, but we really want you to know that we are interested in you as much as you're interested in us. And then looking for a job and getting one. It shouldn't be a bad experience, as I mentioned. Interviews should be good. You are there to learn as much about them as they are to learn about you. So don't hesitate to ask them questions and find out more about why is this position open? Is there an opportunity to work remote for this position? There's 100 different questions you can ask that would benefit you in the long run. Also, for our Q&A, we have a couple spots in here that have our QR code that takes you to our career page, where you can also find a list of opportunities that we have got open. And if you have any questions or anything as well, Michael and I are here to answer as many questions as you would like. So there you go.